Hi, I'm Dr. Anthony Ragusa, clinical psychologist, speaking on behalf of the Prescriptive Authority Committee of the Florida Psychological Association. This video is an introduction to the campaign to achieve prescriptive authority for psychologists in Florida, also known by the abbreviation RxP. Psychologists in Florida are advocating for legislation that would permit certain specially trained psychologists to prescribe psychotropic medications, such as drugs to treat depression, bipolar disorder, schizophrenia, ADHD, and other mental illnesses. Prescribing psychologists are already permitted in Louisiana, New Mexico, Illinois, as well as all branches of the military and on Indian reservations. Prescribing psychologists serve a valuable role in filling the need for high-quality psychiatric services, and we believe that Florida needs prescribing psychologists too. Because Florida is in the middle of a mental health crisis. A 2015 study of all 50 states by an independent organization concluded that there are over 3 million adults and children in Florida with mental illness, and over 20% did not believe they received adequate treatment. This gap in treatment is due in part to inadequate numbers of mental health professionals. In 2015, Florida ranked 5th in the nation in terms of areas underserved by mental health professionals. And in 2014, Florida ranked 49th in the nation in terms of state spending on mental health services, despite having the 9th largest budget in the nation. Part of the problem is that Florida does not have enough psychiatrists to meet demand. Another independent study in 2015 predicts that by 2025, there will be a greater gap between supply and demand for psychiatrists in Florida than for any other physician specialty. About 1,200 additional psychiatrists will be needed to meet demand. There are complicated reasons for the development of this gap, but Florida is not alone. There are inadequate numbers of experts in the use of psychotropic medication across the country. Part of the reason is because fewer psychiatrists are entering the field, and those who remain will be retiring at an increasingly fast rate, because the average Florida psychiatrist is over 60 years old. Psychology does not suffer from this problem, with an average age of 49 years old. There are also about twice as many psychologists in Florida as psychiatrists, which means more potential prescribers to help increase access to care. So many Floridians are not getting the mental health care they need, both because of a lack of professionals available to provide the services, as well as poorly funded public mental health infrastructure. What's the solution? We fear that without prescribing psychologists, nurses and other less qualified professionals will be relied on to fill the gap. Most physicians and nurses are very well trained, but much less so regarding mental health. We think psychotropics need to be managed by professionals with adequate skill to do so, and ideally with matching skills in psychological interventions. Let me explain a bit more about what it means to be a prescribing psychologist. First, psychologists are doctoral-level experts in human behavior, with 5 to 7 years post-bachelor's education in psychology. They are experts in psychotherapy and psychological assessment, and have more training in psychology than any other profession in the country. This is in contrast to psychiatrists, who are trained to be physicians, but have postdoctoral training specific to treating mental illnesses, mostly with psychotropic drugs. They do not have the same level of training in psychotherapy or assessment. Next, RxP would not permit all psychologists to prescribe. Only those psychologists who have obtained training in addition to their doctoral-level training specific to psychopharmacology. This extra training is equivalent to a postdoctoral master's degree, and prescribing psychologists must also obtain a year or two of supervised practice and pass a rigorous national exam, similar to what some psychiatrists take. These psychologists then are qualified to prescribe a limited range of medications, those specific to the treatment of mental illnesses. And they must collaborate with the patient's primary care physician. Here you can see an approximate comparison between the training of prescribing psychologists and other physicians. I say approximate because different schools and states vary in their requirements, but it shows clearly that a prescribing psychologist has training that is very competitive with that of psychiatrists. The end result is a professional who is an expert in psychotherapy and behavioral interventions, plus with a working knowledge of how to integrate psychotropic medications into treatment when appropriate. It is also important to note that sometimes people are prescribed psychotropic medications when behavioral interventions may be safer and more effective. Prescribing psychologists are trained to recognize this and can choose to reduce or eliminate psychotropic medications when other options are available. RxP is not a new idea. The safety and efficacy of prescribing psychologists was first demonstrated in the 1990s as part of a pilot program funded by the Department of Defense. Since then, we have over 20 years of experience showing that prescribing psychologists can do so safely and effectively. In Florida, there are already psychologists who have the academic and hands-on training necessary to become prescribers. So if RxP legislation is passed, there should be an immediate, albeit modest, increase in the number of prescribers. Once psychologists have the legal authority to prescribe, we expect many more psychologists will take advantage of that option. All prescribing psychologists will be regulated by the Board of Psychology and will be required to obtain continuing education to keep them abreast of changes in the field. Educating, training, and regulating prescribing psychologists would come at no significant cost to the state of Florida. We hope you agree that prescribing psychologists are critical to the growing mental health crisis in Florida. Prescribing psychologists are safe, effective, and will increase the accessibility and quality of services provided. Please contact us to learn more or to see how you can help us to pass RxP legislation here in Florida.